Now let's go to observation of areas that are related to the Shaoyin heart channel. So if you have redness at the inner canthus or irritated eyes, this may indicate wind or fire in the heart channel. Swollen and deep red vessels under the tongue may also indicate heat toxin in the heart channel. Raised red papules in the area around thoracic vertebra 5 or the fifth thoracic vertebra, which is at GV11 on the back, may indicate toxic heat in the heart. So it's around T5. Pulse palpation.
Mahapdi yan, Dok.
Opo.
Mahapdi po yan, Dok.
Nakaka-relate po kayo?
Yes po, Dok. May mga nakikita po ako mga pasyenteng ganyan. Tapos nung unang sabi nila, hindi gumagaling. Sabi niya kahit daw ginagamot na ng doktor, hindi gumagaling.
So dapat tumitingin sa heart. No, dapat siya dinidetox. Meron kasing toxic heat sa heart. So baka naapektuhan talaga yung heart. That's it. Now, punta naman tayo sa pulse palpation ng mga areas related sa Shaoyin heart channel. So try palpating the pulse in the area around heart 6 and heart 7. If you can do it now, mas maganda. For excess and deficiency, it is easiest to feel a strong pulse in this area when excess affects the heart. Tenderness and some puffiness in the area around heart 3. This can show a dermatological condition involving heat in the heart. But significant change in this area is rare. Tightness or thickening of the fascia in the forearm, or if you find nodules along the heart channel, a few inches proximal to heart 4, this may be linked to memory problems or chronic mental fogginess. So this could be the reason why some of us can hardly remember some important data. So if there is thickening in this area, so heart 4, there you have to refer the patient to a cardiologist. Most likely, meron po siyang angina or valvular problems associated with rheumatic heart disease. So this is where in the West, but it can be very common in the East, in Asia. Some types of skin disease may also correspond to changes in the heart 4 area. The area
Dok, ibig sabihin, Dok, pag may blockage yun ang isang parang solusyon natin dun sa memory na, ang tagal ko makaalala, pag may block po yun, hindi siya magpo-flow. Yun nakaka-apekto sa memory natin.
Yes. Hindi kasi siya, may connection po kasi yung heart natin sa brain and the eyes. So heart channel, no? Through the heart channel. So very important din po yung area between heart 4 and heart 7. So if you can feel that the skin is thin or rough, na may mga very small grainy nodules, so again, we have to refer to a cardiologist. Baka meron po siyang conductivity problems in the heart leading to irregular heartbeat. Kaya napaka-importante that we should study the pulse and to be able to really determine the regularity of the rhythm.
Saka palpation na, Dok, nakakapay yung mga nodules dyan sa channel.
Yes. And you can also feel nodules in the case of heart type insomnia. So nodules from heart 4 to heart 7 or heart yin blood deficiency type memory problems, especially sa elderly. So one may therefore think of this area as generally reflecting the condition of microcirculation in the brain. So I think this is the reason why nagkakaroon ng dementia, no? Ang iba, or Alzheimer's. It may also be very tender where there are dermatological problems involving heat in the heart. So I guess the cardiologist should be grateful for tying up with us kasi marunong tayo mag-refer. Now, punta naman tayo sa heartache. So, palpate your heartache, everyone. If you feel na parang tender siya or may mga soft nodules siya, maliliit, there is excess heat in the heart channel. Kaya we always use this point every time you have palpitations or namumula yung mukha. And if there are changes at heartache, this is seen in sleep-related pathodynamics. So if there are changes there, the patient might wake easily throughout the night. Hindi maganda yung tulog. There may also be changes palpated around heartache in conditions involving the tongue when the heart channel or organ is involved. Okay, so let's try to summarize. So let's start with the heart 3. Pag meron po tayong nakitang swelling or slightly raised na bukol dyan, so we may think of heart-type dermatological conditions. So if there are tenderness naman sa heart 3, excess-type condition affecting the heart. No? Now for heart, okay, let's go now to heart 4 to heart 7. Okay. So if you feel some thin or rough skin sensation here, meron pong heart blood deficiency. So now you would understand bakit ang hirap matulog ng pasyente, no? Pero nakakatulog naman siya, pero yun nga lang, matagal makatulog. That's heart blood deficiency. So try to feel for some rough sensation along this area from heart 4 to heart 7. Now, if you feel some tightness or thickness, there is excess type heart problems. And this may involve dermatology. So baka may skin usually kasi pag mapupula, skin issues po yan. Dermatologic issues. Now, kung may nodules naman, heart 4 to heart 7, the microcirculation in the brain is affected, or baka tumatanda na tayo and we have memory problems. Okay? Then tenderness, heart 4 to heart 7, there is heat from deficiency, insomnia. So when you have heat from deficiency, insomnia, ito yung mga taong they have nights, they keep waking up throughout the night. No? Kasi mainit yung pakiramdam. Then memory problems also. Now,
Tapos yung lagi na nanaginip, Dok, ano?
Oo, hindi. Putol-putol yung tulog. Then dream disturbed sleep. Yan. Kaya nagigising. Then grainy naman, pag grainy sensation there's conductivity problems in the heart. So, i-check natin, baka irregular yung heartbeat. Now we go to heart 6 to heart 7. If there is a strong pulse here, excess po yan, affecting the heart. Pag grainy naman, there is stasis type of insomnia. Now for heart 8, pag may tenderness, there is some heat affecting the heart or the tongue. Pag may nodule sa heart 8, there is more chronic heart heat. Okay?